I'm Dr. Jannatul Ferdause. I'm a radiation oncologist working as an associate consultant in the Department of Radiation Oncology. So today I'm going to talk about my study on prevalence of depression and anxiety among breast cancer patients in Bangladesh, an often overlooked aspect of breast cancer management that essentially needed to be addressed across sectional study. So what is anxiety? Anxiety is our body's natural response to stressful, dangerous, and unfamiliar situation, while depression is the feeling of sadness and a lack of interest in previously enjoyable activities. Both these conditions can highly affect people's life, causing negative changes to their functionality and productivity. Getting breast cancer is not an easy situation. After being diagnosed with breast cancer, patients go through a profoundly distressing experience. In addition to the physical symptoms related to the illness and its treatment, patients often face significant psychological burden. And this psychological impact may range from some non-pathological state like general concern, worry, sense of uncertainty, sadness, and increased level of hopelessness to specific psychiatric symptoms like anxiety and depressive disorders. And these are associated with increased distress and marked disability, increased physical symptoms like pain or nausea, poor quality of life, poor adherence to the treatment, ultimately leading to poorer prognosis and higher mortality rate. Therefore, treatment of cancer must include all human aspects, including the psychological one. Unfortunately, the psychological aspect of breast cancer care are frequently overlooked, particularly in countries like ours. That's why we conducted our study to investigate the prevalence of anxiety and depression among women diagnosed with breast cancer and to evaluate relationship between these mental health conditions with various social and clinical determinants. And how we did this? A cohort of 188 breast cancer patients was recruited from Asani Mission Cancer and General Hospital, a charitable tertiary cancer care center, between January 2024 to June 2024. And the inclusion criteria were the patient must be aged at 18 years or more with histologically documented diagnosis of breast cancer, no history of prior mental disorder or dementia, no abuse of alcohol or drugs, and satisfactory level of communication. Participants were interviewed after providing verbal consent and with assurance of their confidentiality. The structured questionnaire included social, clinical, as well as big depression inventory and manifest anxiety scales that was translated in Bangla to assess the level of depression and anxiety. Finally, the data was stratified and analyzed systematically. So, what is the result? In a nutshell, we found that the prevalence of anxiety symptoms stands at 34.5%, that affecting 65 out of 188 participants, while the prevalence of depressive symptoms is notably higher at 41.4%, that impacting 78 out of 188 participants. So here I have showed the distribution of the patient according to the age, where most of the patients was in between age group 40 to 49, and we found that depression and anxiety were more observed among the younger women. Here's the distribution according to the marital status, where most of the patients were married, and depression was statistically significant among married women. Here's the distribution according to the educational level, where most of the patients have studied up to primary or they were illiterate. And here we found that depression and anxiety were statistically significant among the women who were either illiterate or studied up to the primary than women who have studied up to secondary or higher, and p-values were significant respectively. It is the distribution according to this dependency, where most of the patients were dependent or unemployed, and anxiety was relatively more observed among the women who were dependent. The p-value is 0.019. It is the distribution according to the monthly income. We have divided into three groups, like monthly family income less than 10K, 11 to 20K, and more than 20K. And we found that anxiety were more observed among relatively less solvent women. It is a distribution according to the accompanying person, where most of the patient, like 139 patient came along with their husband, 18 patient came family member or friends, and 31 patient came by their own without having any accompanying person. And it is the result that shows depression was more observed among the women who visited alone or along with their family members other than husband or partner. It is the distribution according to the age of last child, where 20 patients had no child or they're single, 61 patients have ALC less than 10 years, 75 patients has ALC in between 10 to 20 years, and 31 patients has ALC more than 20 years. So anxiety were more observed among the women with ALC less than 10 years, and people was significant. It is a distribution according to the stage, and 3.4161% patient was in stage 3. And we found that depression was more observed among the women with advanced stage of disease. It is a distribution according to the line of treatment, where 147 patients received up to first line treatment and 41 patients received second line or beyond after disease progression with first line treatment. And we found that anxiety were more present among women who received chemotherapy or targeted therapy in second line or beyond. Here we have showed the type of surgery, where most of the patients were have underwent mastectomy, and depression were more common among the patients who underwent mastectomy. So, result in summary, our study found that younger, married, illiterate patients with no accompanying person, those with advanced disease, and patients who underwent mastectomy were more likely to experience moderate to severe depression. Meanwhile, younger, illiterate, financially dependent patients with children under age 10 years and those receiving chemotherapy or targeted therapy in second line or beyond were more prone to have moderate to severe anxiety. So obviously our study was not out of limitation. Our study was conducted in a single center that cannot be representative of the whole Bangladeshi community. Further studies must be include other centers. And in discussion, we can say that according to the ISMO clinical practice guideline, all patients with cancer should be regularly screened and assessed for the anxiety and depression in all phases of illness. Clinicians must distinguish between non-pathological mood fluctuation, sadness, and serious anxiety or depressive disorder. If the symptoms are mild, psychological support can be sufficient, while for moderate to severe symptoms, specialist mental health referral system should be done for integrated care that includes both psychotherapy and pharmacotherapy, like antidepressants, anxiolytics. Among antidepressants, SSRIs have few significant drug interactions, with the notable exception of tamoxifen metabolism, which is least affected by escitalopram, sertraline, and venlafaxine. The only antidepressant to demonstrate a negative clinical outcome is paroxetine, which must be avoided in patients taking tamoxifen. So in conclusion, given the result of our study, clinical oncologists should pay more attention to psychological aspect of this targeted group of patients. A proper specialist mental health referral system should be established to assure providing the psychological care. Oncology clinicians should have a foundational understanding about the available treatment options, and by addressing both physical and psychological concern, we will be able to provide comprehensive patient care and improve overall outcome of our breast cancer warriors. Thank you.